Hi everyone and welcome to my YouTube channel. On this channel we discuss everything about health, awareness, HIV care and support, and how to create awareness to stop HIV stigmatization. I am Esther Akawe Ube, a physiologist and HIV prevention care and support officer with over 6 years experience. Yes, 6 years experience working both in the hospital and in the community. In today's video, we'll be discussing a very crucial and important topic, which is signs and symptoms of HIV infection in both men and women. Whether you are curious or concerned, or you have someone that you are taking care of that you are suspecting might be at risk of HIV infection, this video will give you a factual and helpful information on how to go about it. So stay tuned as we dive down into the topic for the day. From my experience working with HIV positive beneficiaries, HIV positive persons, both in the community and in the hospital, I've actually noticed a common sign and symptoms in both of them. Though there are some persons that come up with peculiar signs and symptoms, yes, because HIV signs and symptoms, they are different with different persons. Yeah. Sometimes you might see a sign in this person that is not in the other person, but in most cases, there are always one or two signs that is always common among them. So we'll be discussing all of that today. First off, what is HIV? HIV simply means Human Immunodeficiency Virus, and it's a virus that affects the immune system, specifically the CD4 cell, which helps fight infection in the immune system. If HIV is not well treated, it might lead to AIDS, which is the advanced stage of HIV. But the good news is, with early detection and early treatment and management, people living with HIV can live a healthy, long life without issues or complications. Now, let's talk about the symptoms, which is our topic for today. So, we'll divide these symptoms into 3 stages. One, we have the acute stage. The second one, we have the chronic stage, and we have the AIDS stage. So, first off, let's talk about the acute stage. Acute stage is the first stage within 2 to 4 weeks of infection. You'll be experiencing things like fever, sore throat, fatigue, rash, swollen lymph nodes, muscle aches, and night sweat. Most times, this acute stage and the symptoms that comes up during the acute stage, some persons mistake it for bad flu. Yes, most persons, the thought of HIV does not even come to play in their mind. They mistake it for bad flu, but in most cases, it's always the first stage of HIV infection. Then let's talk about the chronic stage. In this chronic stage, some persons in their chronic stage, they don't experience any symptoms or signs for years, but though the HIV infection will be in the body, maturing gradually and very active, but they will not experience any form of signs or symptoms. Sometimes we refer to this as the asymptomatic stage, because there is no sign, there is no symptom, nothing showing that anything is wrong with you. But whereas the virus is in the system, very active and multiplying with time. The third one we're talking about is the AIDS stage, which is the advanced stage of HIV. In this stage, you experience things like rapid night sweats, recurring fever, prolonged fatigue, sore in the mouth, sore in the anus and in the genital areas for both male and female. And also, some persons might experience pneumonia and also memory loss, depression, and other neurological issues that is peculiar to individual. Having divided all these signs and symptoms into 3 stages, like we said, the acute stage, the chronic stage, and the AIDS stage, let's talk about the signs and symptoms that is peculiar to men. Then we'll now discuss the signs and symptoms that is also peculiar to women. Like I said earlier, HIV affects everybody differently. It affects men. Since we're talking about men, let me be specific. HIV affects men differently, but there are some signs and symptoms that is common among most men. 80% of them experience this alongside other signs that might be peculiar to them. One of them is swollen lymph nodes around the neck, the armpit, and the groin. Yes, so most of them experience swollen lymph nodes around the neck, around the armpits, and the groin. Also have painful sores or ulcer around the anus and the penis for men. We also have low testosterone. Yeah, a lot of them, this testosterone hormone, the amount is drastically reduced. So the extent it leads to fatigue, mood change, and reduced sexual drive. A lot of men experiences reduction in testosterone level. Another symptom that is common among men is penile discharge and pain when urinating among men, especially for those that have co-infections like STIs. They find it difficult whenever they are urinating. It's always painful, and most times it comes with co-infection with other STIs like gonorrhea and the rest. We also have persistent skin rash. For men, most men, they experience this persistent skin rash, which is often on their face, on their chest, and at their back. And that one is frequent infections. Like, you will treat one infection before you know the infection is coming back. Like, you don't permanently treat an infection because it will keep reoccurring. Reoccurring infection. But though a lot of some persons might have all these signs and symptoms, and it might not also be HIV infection. So these ones are common signs and symptoms that are always obvious for men that are HIV positive. But these do not necessarily confirm that the man is HIV positive. But when you notice all these signs, especially after risky exposure, like sharing sharp objects, um, having sexual intercourse with someone you don't know his or her HIV infection, and like all those risky exposures, and you after all those risky exposures, you're noticing all these signs and symptoms, the best thing at that point is to go to the hospital to conduct tests, get tested, and know what exactly the problem is, so you get treated. And if it's HIV, you can just be linked into antiretroviral therapy, and you start your medication. If you've watched this video to this extent and you are finding what we are discussing interesting, don't forget to give us a thumbs up. Don't forget to share. Most importantly, subscribe to our YouTube channel so we can continue bringing you healthy tips on how to manage HIV and AIDS infection, and also how to care for people living with HIV and AIDS. So let's dive down to signs and symptoms of HIV in women. Don't forget, like we said, for men, HIV infections in female, the signs and symptoms are different for two different persons, but there are peculiar signs and symptoms that you always find among women. 90% of them, they exhibit these same signs and symptoms, outside others that they might experience that are peculiar to them. So what's the first one we'll be talking about here? A frequent yeast infection. Frequent yeast infection or bacterial infection. Another sign and symptoms of HIV that is common among women is changes in menstrual cycle. Another one is pelvic inflammatory disease, PID. These ones are signs and symptoms that are common among female that are HIV infected. We have pain during sex. We have, like we said before, have pelvic inflammatory disease, PID. We have pain during sex. Some persons also, most of them experience unusual vaginal discharge, like you are frequently having vaginal discharge unnecessarily, you have genital ulcers, and so. This thing we just listed as common signs and symptoms that you see among women that are HIV positive. Outside these ones we've listed, also women that are positive, the women that are HIV positive also experience night sweats. They also experience fatigue. They also experience unexpected weight loss and the rest. But unlike men, the signs and symptoms of women that are HIV positive are more around their reproductive system. Their reproductive system are mostly affected. That is why if women that are positive, you can easily identify them. Just maybe they are having this recurring yeast infection, they're having recurring pelvic inflammatory disease, and they just go to the hospital and it's identified. But like men, most of those signs can be mistaken for other infections or other, like I said, bad flu or all the rest. But women, most of these symptoms associated with their reproductive system is more among women compared to men. HIV is not a death sentence. Like I will always say after my videos, HIV is not a death sentence. Early detection and linkage to care is the best cure for someone that is HIV positive. And the key is early detection, and if found positive, link to treatment immediately. So let's end the stigmatization. Let's talk publicly. Let's increase awareness to testing. Let people know the importance of testing. Don't assume. Let people know the importance of testing. Reduce stigmatization. A lot of us have this issue of whenever you just say that somebody is positive, you are feeling like the person is gone. The next thing that will happen to the person is death. It's not like that. Avoid stigmatization. Create proper awareness on testing and encourage one another. Until our next video, stay safe and stay healthy.